To the latest on COVID-19 this morning, Dr. Mathew Devine, the medical director at Highland Family Medicine, is live with us this morning once again. Doctor, good morning.
Good morning, Mark.
All right, so we are talking about the Delta variant of the coronavirus here. Let's begin by talking about the latest on strains and COVID-19 infections. The news has been good of late.
Yeah, that's totally correct. This has been a long journey, I know. We have a lot to celebrate with the 70% vaccination rate in New York of getting at least one dose. However, there is a highly contagious, very fast and fit coronavirus strain that is making its way around the world by the name of the Delta strain that we do need to have a pause and be a little worried about for those that are unvaccinated.
Where did this particular strain come from, Doctor?
So the strain was first identified in India, and it's said to be more lethal because it's actually more efficient in its way that it can transmit from human to human, and it can really kind of then find that most vulnerable person that can become quite ill and sick, needing hospitalization.
Why is this important news now? What do we need to be focused on here?
Yeah. So the thing about it now is that we, have the strain that's 60% more transmissible than the previous alpha strain, which is more highly contagious than the first strain that was out of Wuhan. And we now have this in 92 countries. It's making up 10% of all of the new cases in the United States. And it's quickly becoming this dominant strain that we have, that we're seeing in the U.S.
All right, obviously the key question here, Doctor, what do we do about it? How do we keep ourselves healthy in the face of this strain?
Right. I think the biggest thing is everyone who's eligible for the vaccine, please get it now. The risks of getting COVID are far higher than the risks of getting the vaccine. And so there are still under 12 who can't get the vaccine yet because of the trials, but there are those that can get it. So I beg and plead that people consider that, because there are still some zip codes in the county that are still down as compared to that 70% number we're talking about.
Right. We've gotten to the 70%, but that's not 100%. Still a little way to go as we continue along this journey here during the pandemic. Doctor, as always, thank you for a few minutes this morning. We appreciate it.
Thank you.
If you missed any of this conversation on the Delta strain, we are sharing it online shortly at rochesterfirst.com.